The Google Health pipeline is still ingesting your medical records right now, and HHS can't stop it. That is the live state of a data handshake between Google and the largest private hospital network in America. The Department of Health and Human Services opened a formal investigation. They reviewed the system, they closed the case, and the pipeline kept running. The document that proves it is a contract Google never had to hide because the law made it invisible. Google called it Project Nightingale. Officially, it was a cloud computing partnership with Ascension Health, a Catholic hospital system operating 150 hospitals across 25 states. The pitch was reasonable. Google's infrastructure would help clinicians surface patient histories faster, reduce redundant testing, improve care delivery. That is the press release version. What the agreement actually authorized was the transfer of complete medical records for 50 million patients into Google's cloud infrastructure. Records containing diagnoses, prescriptions, lab results, surgical histories, and social security numbers. The patients were not informed. They were not asked. The records moved silently as new clinical encounters were added in real time, and the transfer has never stopped. Here is what the partnership actually did beneath that description. Google engineers, not hospital clinicians, not licensed providers, received direct query access to identifiable patient data across Ascension's entire network. Full names, full records, a persistent identifier tied to each patient's complete longitudinal history, updating live. The data was not staged for analysis and then discarded. It was retained inside Google's own infrastructure under a schema Google engineers helped design. Internal communications later reviewed by the Wall Street Journal showed Google personnel actively querying that data, running searches against real patient records, constructing predictive models, testing algorithmic outputs against clinical histories at scale. This was not a billing processor. This was not a transcription service. This was a search and machine learning company with live read access to the most sensitive health data in the country. And it's still running. The ingestion pipeline never terminated. The business relationship continued. The records are still there. HHS OCR, the federal office specifically empowered to enforce HIPAA, launched a formal inquiry within weeks of the story breaking in November 2019. The investigation ran for over a year. Patient advocacy groups filed complaints. Senate committees sent letters demanding answers. The inquiry had formal standing and subpoena authority. In 2021, HHS closed the case. No fine, no consent decree, no corrective action plan, no public accounting of findings. The agency chartered to prevent exactly this looked directly at 50 million unnotified patients and found nothing actionable. The people meant to protect you already lost. And the pipeline is still running. Here is the part nobody reported clearly, and this is where it stops being a scandal and starts being a structure. HHS did not fail because of negligence. They failed because the statute handed Google a legal exit before the investigation ever began. HIPAA contains a provision called the Business Associate Exemption. When a hospital executes a business associate agreement with a technology vendor, that vendor is legally permitted to access protected health information without patient consent, as long as the access supports the covered entity's operations. Google and Ascension executed that agreement before a single record transferred. What looked from the outside like a covert health surveillance program was, on paper, a fully compliant IT contract. The exemption was drafted in 1996. It was written for billing clearinghouses and transcription vendors handling paper charts. It was never intended to authorize a machine learning company to ingest 50 million patient records and run predictive modeling at national scale. But the language did not exclude it. So HHS had no enforcement mechanism. And here is the telemetry handshake that makes it genuinely unstoppable. The agreement never expired. Google's health infrastructure operation, now running under the Google Cloud Healthcare API, holds active business associate agreements with hospital networks across the country today. The API is a current, listed, publicly priced product in Google Cloud's catalog. Any hospital can execute an agreement this week. The data flows. The persistent identifier remains attached, and there is no federal requirement that a single patient be notified when their records enter that pipeline. Think about what that means for your records right now. If you have received care at an Ascension facility or at any hospital system running on Google Cloud Healthcare API, your complete medical history may be inside Google's infrastructure at this moment. Your diagnoses, your psychiatric treatment notes, your HIV status, your oncology records, retained and queryable by engineers you have never met, under a contract you never saw and were never given the opportunity to refuse. You cannot opt out under HIPAA because Google's classification as a business associate specifically removes patient-facing obligations from the relationship. The privacy law designed to protect you contains the precise legal mechanism that strips your right to know. The audit trail exists. The telemetry handshake is documented, and it's still running. So ask yourself who benefits from that arrangement staying exactly as it is. Google gains health training data at a scale no clinical trial can produce. Hospital networks receive discounted cloud infrastructure. HHS closes a case without reopening a 30-year-old statute. And 50 million patients get nothing, no disclosure, no choice, no mechanism to remove their records from the system. The one question no investigation has answered publicly. If HHS knew the business associate exemption made this legal before they opened the inquiry, what exactly were they reviewing for 18 months? And what did they find that they decided you didn't need to know?